I'm ABC 15 data analyst Garrett Archer, and I'm taking you inside the numbers on the steady but rising presence of COVID-19 in Arizona right now and what historically the data says it will do next. Arizona's Department of Health Services reporting about 3,086 confirmed COVID-19 cases last week. It's a 13% increase from the same time last month, around July 4th. While COVID does seem to be on the rise, the number of confirmed cases is tiny compared to the three-year average. For this week, cases there are 74% lower. Speaking of the three-year average, 2022 was the year with the most number of COVID-19 cases reported in Arizona, almost 1 million. And case numbers themselves do not really tell us anything about COVID-19 anymore, but the week-to-week trend can still tell us something. This is the same chart, but with the winter surge cut out to better show that three-year average trend line. It shows that we are probably right now in the midst of a summer peak, and it will begin to subside until late October. After that, the winter surge does begin for COVID-19 when that traditionally hits its annual peak. So if you haven't had it yet this year, you might avoid it until December or January. The biggest concern is still for those rare cases in which COVID-19 requires a hospital visit. 376 of them this week in Arizona, a small 5% increase from July, but 35% lower than the three-year average. A little over half of COVID-19 hospital visits are Arizonans 65 or older. Finally, COVID-19 deaths, 581 of them this year so far. It's a third fewer than July and a 92% decline from the three-year average. A note though, COVID-19 deaths do tend to lag about a month. So while a decline is still expected in these numbers, the drop will likely be less than what we're seeing right now once the data firms up. With a look inside the numbers, I'm Garrett Archer, ABC 15, Arizona.